Here's an interesting question. A 36-year-old woman comes to the emergency department because of left wrist pain and a swelling that started immediately after a fall. She was walking her dog when her dog abruptly pulled away, causing her to fall forward onto both hands. Physical examination shows left wrist pain with pinching and grasping, moderate swelling, and mild tenderness. A left thumb is placed in a thumb immobilization splint. An X-ray of the wrist 2 days later is shown. Which of the most likely cause of these findings is a fracture of which of the following bones? Can you guys see a fracture? It's pretty obvious. So which bone is that? All the carpals here: scaphoidal, ulna, radius, lunate, hamate. So this has a lot of clinical significance even in actual clinics, and just out of the textbook. There is a lot of clinical significance for scaphoid fractures. They are quite normal. So patient generally presents with pain in the anatomical snuff box. If they ask you about pain in the anatomical snuff box, it's scaphoid fracture. And more often than not, when you do an X-ray of a scaphoid fracture, it wouldn't show anything, for the first 2 weeks or so. So you really need to be vigilant about it. Whenever there is a patient and you suspect a scaphoid fracture, you just give them a thumb spica splint and wait for 2 weeks and then do the X-ray again so that you can actually see the fracture line. And avascular necrosis is one of the other very big complications of scaphoid fracture. The distal part of scaphoid is not really well perfused, and if there is a fracture, avascular necrosis is very, very common. So you need to look out for that. Yeah, that's just it. I explained it. Even we can discuss a bit. Scaphoid is the most commonly injured fractured carpal bone. Fracture results in axial load injury to the hyperextended. Blah blah blah. Although many scaphoid fractures can be treated conservatively with immobilization, proximal pole fractures carry a high risk of avascular necrosis and often require surgical fixation. Fracture of the ulna is caused by a direct blow or fall to a pronated forearm. The fracture results in localized pain, swelling, and often gross deformation or loss of range in motion. X-rays do not show an ulnar fracture. No. You cannot see an ulnar fracture in this. This is hamate. You can see the hook of hamate. I don't think there are a lot of hamate fractures and such. You can see a lot of radius and ulnar fractures. And lunate fractures and perilunate dislocations are rare injuries resulting from high energy trauma to a hyperextended and ulnar deviated wrist. Patient present with wrist pain, swelling, and occasionally median nerve injuries. Not consistent with a lunate fracture. You just need to focus on the important ruling out. You need to rule out all the options, and this one was pretty easy. A fracture of the hamate body is rare. You don't need to know about it, to be honest. All you need to know about is a scaphoid fracture, guys.
Thanks for watching. Please give a thumbs up and subscribe for more.